Good afternoon, everyone. I'm Ernestine Briggs King, an associate professor of psychiatry and behavioral sciences, and I'd like to welcome you to the fifth webinar in the Taking Care of Yourself and Your Loved Ones series. This series is designed to help support the mental health and well-being of our faculty, staff, trainees, and students. Today, we're going to discuss a difficult topic: preventing youth suicide. In 2019, suicide was the second leading cause of death for 15 to 24-year-olds in the United States. And over the past year, we've seen increasing isolation, anxiety, and depression among children, teens, and adults. However, in many cases, suicide can be prevented. In this webinar, Dr. Angela Tuno is going to help us understand the risk factors for youth suicide, how we can talk to our children, teens, and young adults about it, and how we can get them to help when they need it. Dr. Angela Tuno is an assistant professor in the Department of Psychiatry and Behavioral Sciences. Her research interests include public policy and advocacy for children, youth, and families, prevention of child maltreatment, resiliency factors of post-traumatic experiences, the intersection between trauma exposure and high-risk behaviors such as suicidality, and the dissemination and implementation of evidence-based therapeutic interventions. Dr. Tuno specializes in clinical interventions for adolescents, children, and families with an behavioral and emotional difficulties such as traumatic exposure, chronic emotional dysregulation, substance use, and self-harm. And before I turn it over to Dr. Tuno, just a few quick notes about submitting questions today. You can use the Q&A feature at the bottom of your screen to ask a question at any time during the webinar. But we'll hold off on responding to questions until the end of Dr. Tuno's presentation. Please note that you have the option to ask questions anonymously. We will also be using the chat feature on today's webinar. And now I'll turn it over to Dr. Tuno, and thank you for being here today.
Thank you for that wonderful introduction, Dr. Briggs King. I'm going to go ahead and pull up my slides. Can you all hear me and see me okay? All right. Thank you all for chiming in already. This is great. Okay. So today we're really going to focus, and I'm honored to be here. I'm honored that you all took the time on a Wednesday at 4 o'clock to spend some time holding space for this very important topic of understanding and preventing youth suicide. And given that this is a wellness webinar series, I do want to start with focusing on wellness. So just for us to take a moment, and I think, when I was building this slide deck, I was thinking, we usually end with make sure to take care of yourself, but I want to start with that, of acknowledging that the topic that we're covering today can be very difficult. I want you all to lean in and monitor your own distress level, check in, where are you, orient, breathe, step away from your screen if you need to, do something relaxing and nourishing right now in this moment, instead of waiting for the task to be done, because I think sometimes it's not done and we have to take care of ourselves right here and now. Take a mindful moment through your senses, look at this beautiful picture, orient to the date and the time. It's Wednesday at 4, take a big breath. And I have a link down here to the Pause, Reset, and Nourish document that Dr. Robin Gurwitch covered on the first webinar. And this is just a really nice way that the NCTSN gave some really key information about how to incorporate wellness in everything that we do, ways to check in quickly and take care of ourselves in the here and now, as well as long-term goals. Thank you, Susan, for posting that. The link is in the chat if you all are interested in seeing more. I'm not going to go into this video quite yet, but there is this wonderful video put out by the Mayo Clinic that talks about suicidal thoughts and behaviors in teens. We're going to see if we can get to it. I know I only have 20 minutes or 22 minutes, so I want to make sure to get to some key resources for us to discuss. So let's start off with the scope of the problem, focusing in on youth suicide. I want you all to take a look at the 10 leading causes of death chart here on the side. So if you look at 10 to 14-year-olds, 15 to 24-year-olds, and 25 to 34-year-olds, you'll see that the second leading cause of death is by suicide in youth. We do see that there are higher rates in males than in females. And when we're looking at trends, we know that there was a 56% increase from 2007 to 2017 in suicide for our youth. Now, I don't want to overstate this, but the most recent statistics from 2018 to 2019 showed a decrease in certain subsets of the population. So for 10 to 14-year-old males and for 15 to 19-year-olds, we saw a slight decrease. We don't want to overstate that because we're still learning what's happening in 2020. I also want to acknowledge the most common method for suicide in youth is suffocation and strangulation, as well as firearms. For suffocation and strangulation, those are the most common for younger youth, 10 to 14, and then firearms as folks age. So when we're thinking about prevention and intervening on suicidal thoughts and behaviors, it's really important to talk about means restriction and knowing what those methods are. Okay. Now, jumping into talking about suicidal thoughts and behaviors in youth. You all may remember doing this survey. I remember doing it in high school. It's the Youth Behavior Surveillance System survey that's given to all high school students, 9th through 12th grade, where they ask a bunch of questions about risky behaviors. So they'll ask things like drug use, or are you wearing your seatbelt, other high-risk behaviors. And it gives us an insight into what high schoolers are doing and the behaviors they're engaging in, and even how they're thinking. So the 2019 data just came out. There's a link to it right here. I encourage you all to go in and look because they did a nice job disaggregating data or looking at it based on sex and race and looking at disproportionalities. And so it'll be important to look at that. But to take a look at what our high school students are saying in 2019, over the past year, about 19% seriously considered attempting. And I want you to note the differences between females and males there, with females being a higher percentage. The number that made an actual plan about how they would attempt is 16%. Again, females higher than males. And for those that had an actual attempt, at least once, that was 9%. Again, females more than males. So we're seeing this linear increase since 2009. And mainly that increase is accounted for in females and not necessarily males, but it's important to know where those trends are going. And I also want to highlight here at the bottom that females are more likely to have thoughts and non-lethal attempts compared to males, where males are more likely to die by suicide when we're comparing the two sexes. Okay. Now I'd like to jump into talking a bit about risk factors, or those things that are associated with suicidal thoughts and behavior. And I want us to sit back and think about the past year. So it's important to acknowledge that there is no single factor that predicts suicide. And it's really important to lean into that, although risk factors do exist. And I want us to think before 2020 and during 2020, what are some risk factors that you think, and you can put it in the chat, are associated with distress, maybe suicidal thoughts and behaviors for our youth over the past year? in 2020 and beyond? And I'm looking at the chat. Paul, thank you. Bullying, yep. I'm seeing social isolation. Thank you all for participating. It's great. We've seen a lot of isolation over the past year. Loneliness, parents losing jobs. That's really important, Nicole. And we're going to talk about that in a second as well, about the impact of that in the family. Feeling disconnected from the community, absolutely. I'm seeing social isolation a lot, which is key. Trauma, drug use, family stressors are magnified, right? Of if there is some tension or difficulties in the home, then that containment can be difficult. Family history of suicide. Home with abusive relationship, yeah, that was common in here. College students and rigorous studies. I'm so glad that you mentioned that. Yeah, the pressure of having to perform while under these really unnatural conditions. Stress of getting into college, inability to communicate suicidal thoughts, inconsistent mental health treatment. Yes, you all are great. Keep putting those in there. I think it's important to discuss these things and not just, you know, when we're talking about 2020, not just COVID. We have many things going on at once, including the pandemic of continued racism, being a member of the marginalized community, not having someone you can talk with that you trust. So let's look at some common risk factors. So there's precipitants, or things that happen right before. That can be interpersonal conflict, loss, grief. I want you all to think about grief, and especially for our youth, we can think about grief in the loss of a person. We can think about grief in the loss of certain milestones, right? So I was supposed to graduate high school, or I was supposed to go to college, or I was supposed to graduate college, and those things they looked different, and there's some grief in that. Demographic or specific populations, so age, gender, we talked about the difference between males and females. Race and ethnicity, we know that for youth, American Indian and Alaska Natives had a consistently higher rate of suicide. Our LGBTQ youth, we know that for those youth, some statistics say they are 3 times more likely to have attempts when compared to their heterosexual cisgender peers. And somebody mentioned this in here too, of having that lower access to mental health care or inconsistent care. And you all really hit on this, the social piece, feeling alone, feeling isolated, really being, and you know in adolescence how important peers are, having that economic hardship, parents are losing jobs, things look different. I may be in an unsafe or abusive living situation and contained in that, right? So it can, for some families, be a pressure cooker of sorts. Some other ones, somebody also mentioned this in here, y'all are good. So historical, having a history of suicidal behavior of yourself, or even having that history in your family is a known risk factor. Experiences of trauma. So we know that, you know, in big meta-analyses that all types of child maltreatment have been related to suicidal thoughts and behaviors, especially around sexual abuse and emotional abuse. And there is this dosage effect. So meaning cumulatively, the more trauma you experience, the more intense that relation is. There's also psychiatric conditions, right? Mental health conditions, substance use disorders. We did note, and again, I want to state in 2020, we're still learning what's going on, but we do have some data to suggest an increase in calls to hotline. This is from the SAMHSA disaster distress hotline of 891% increase in March 2020 compared to March 2019. And we don't necessarily know what that means. And I put a note in here for us to think about too, of that it could be positive for help seeking, that maybe folks are reaching out for help more. Another risk factor, access to lethal means, that can be firearms, substances. And it's important to know too, in 2020, that the US firearm purchase increased 85% in March 2020. So when we're thinking about ways to prevent suicide, when we're thinking about intervention, all of these risk factors are important, and to think about the opposite of protective factors. What can we do to intervene, which we'll talk about in a second. Okay, so hopefully everyone's with me. We're going to go into warning signs and talking to youth. It is important to acknowledge that you know your child best and are the best equipped to notice when things are different and things are impacting their functioning. Not just, teenage stuff, teenage angst, but really affecting their functioning. They aren't getting out of bed. They're isolating. They used to love doing X, Y, and Z, and they're not doing it anymore. It's important to note that there's no single cause that predicts suicides, and they may exhibit warnings through what they do, what they say, how they feel. And I want to give another caveat that not all youth who experience suicidal thoughts show these signs, and not all youth who have these signs may be suicidal. So I want to go back to the first point saying, you know your kids best. It's important to talk about. Okay. And here's some things, this is not all inclusive, but it's some warning signs that we do see. So threatening suicide directly, saying I'm going to kill myself, wanting to die, saying I wish I was dead, or I wish I'd fall asleep and never wake up, having no reason to live, talking about being a burden, really, you'd be better off without me, everybody would be better off without me, stating they feel trapped or describing really unbearable pain. Some behaviors you can look out for, suicide notes and plans, including those online postings, right? Looking at what they're posting in social media. Prior suicidal behavior, withdrawing, increased use of substances, increased sleep problems, sleeping too little, sleeping too much, giving away possessions, increase in agitation and even aggression. And then for mood, that depressive symptom, hopelessness, helplessness, you can see shame, anxiety, loss of interest, volatility, just a lot of ups and downs, agitation, anger, things more than being a teenager and really feeling like something is off. Now, I know I've talked to a lot of parents and being a little nervous about bringing up this topic, which makes complete sense. It's a really difficult topic to lean into, and worried that talking about suicide will put that idea in their head. And I want to just negate that, of saying this can provide such relief, connection, and this open opportunity to have more conversation. And we all talked about, even in the chat, that social isolation is a risk factor, which makes that social connection so, so, so important. And for you all for parents to continue having that conversation, for us as providers to have that conversation with youth. They are talking about it. They see it on social media. They see it on media in general. So really opening that conversation can provide a lot of relief. Now, when you're doing this, you want to provide this open, non-judgmental, and calm atmosphere. That's really hard to do, which is why we focus on wellness of what do you need to be able to stay calm and grounded, because these conversations are really, really intensely difficult, and validate, right? So our knee-jerk response is to ask a lot of questions. Like, why do you feel this way? What made you feel this way? Where did you hear about that? But really, instead, sitting back in our discomfort, staying in this very open, non-judgmental space, saying things like, this sounds like you're really hurting. We're going to get help together. Those sorts of things. And I'll give you all some other things that can be said. The most important thing for prevention, having those regular conversations through safe, stable, and nurturing relationships. And I know teenagers, they are developmentally about their peers, right? But trying to have that special quality time wherever you can find it. I always think about in the car is where I hear parents talking about, that's where they talk the most, or we just had this conversation when I did not expect it. So being able to pause what you're doing if those opportunities do arise, and also offering ourselves grace too, to handle it in the best way you know how in that moment. You're also modeling how to manage emotions in difficult conversations, and you want to encourage them that you're going to get help and support together, that you're going to do this together, that they're not alone, not isolated. And make sure, this is important, to have your own support team who's there to connect with other parents? How are you taking care of yourself in the situation, and sharing that stress, because it takes a lot to hold those conversations and provide that safe and grounded atmosphere. Some things you can say. And again, no script, but here's some ideas. I want you to know that you can tell me anything you're feeling or thinking. Growing up can be difficult, and I want to be here for you no matter how hard the topic feels. Talking about what you're feeling can help you feel better. I'd love to hear what's going on in your life. I know things have been difficult recently. It can be helpful to talk about what you've been dealing with to feel a little better. What's been going on for you lately? And then something more directly, and it's okay to put words on this. Do you ever think about killing yourself? Do you ever think about hurting yourself? I'm here for you, and I really care about you. It's important for me to hear what you're going through. So sometimes naming that out loud, although very hard to do, is important to put words to open that conversation, take the stigma away from it, and being able to have that open dialogue. Okay. I want to spend some time here. So connecting to care and connecting to resources is so important. Seek help if you feel like something is off. We have interventions that exist that are evidence-based. You'll see on the left side here, it's broken up into short-term and long-term interventions. So over at Duke, we'll do the Safety Acute. We have this center here that trains providers across the nation in Safety Acute, which is developed specifically for youth with an adaptation for youth who were exposed to trauma. So that's a really good intervention that we offer. There's also safety planning interventions that exist. Longer term, there's safety intervention developed for youth with suicidal behaviors, and Safety Acute is the first part of the safety intervention. We have dialectical behavior therapy for adolescents and integrated CBT. But what's most important to know is there's some common components in these interventions. They should be collaborative, that we want for youth to be part of their safety plan and part of building a life worth living. We want that to do that collaboratively with youth and families and caregivers. So that's another important component. You should be included on these discussions if you're parents of youth in these interventions. We want to see an increase in safe and healthy behavior and really increase safety. So we want to promote those things that reconnect them, that behaviorally are activating or pleasurable activities they once did, and problem solving around some big emotions they're experiencing. Promote reasons for living and enhancing the natural strengths and resilience that youth come with. Being able to get to know them, build that relationship, that youth come to us with a lot of strengths, and we have the privilege of being able to recognize those and promote those. Access to lethal means is really important. Removing firearms, ensuring safe storage of pills, prescriptions, firearms, especially if someone is suicidal. Resources do exist. I'll walk you through some of them, and you'll have these slides afterwards as well. So we have more crisis resources, so National Suicide Prevention Lifeline. There's also this crisis text line, which it can be more youth-friendly, where they can text this lifeline, text home. The Trevor Project has a Trevor Lifeline. You can see the number here. And this Trevor Project is amazing, and is particularly focused on our LGBTQ youth under the age of 25. There's a link here to the Trevor Chat and Trevor Text. And those two things, they can either, if you go to this website, they can either talk online to a counselor or text, if that's more approachable. There's the SAMHSA Disaster Distress Helpline, and Crisis Solutions North Carolina is really neat. So you can go in and look into your county, and they will give you some mobile numbers that are more crisis specific. Okay. We also have Duke specific resources. So we have the Duke Emotional Support and Wellbeing line, and there's the information, the clinical appointments in Duke Psychiatry and Behavioral Sciences. We have the pediatric number and the adult number, and the personal assistance services for Duke faculty, staff, and families. I know I'm zooming through these, but I want to get to some questions too. And other resources. So this first one is if you're not Duke connected, locating a psychologist near you. We have the American Foundation for Suicide Prevention, wonderful resources for parents in there as well, and for providers. The Suicide Prevention Resource Center, also a lot of information. We have NAMI, the UCLA Duke ASAP Center, which is housed here, I'm a part of, with Dr. David Goldson and Dr. Jonah Sarno, where we do trainings on suicide prevention and intervention, especially that's trauma informed. And we also have the National Child Traumatic Stress Network, the NCTSN. And I encourage you all to go look at the nctsn.org. There are a ton of resources really looking to raise the standard of care and improve quality of care to children and families who've experienced trauma, including children who also experience suicidal thoughts and behaviors in a trauma-informed approach. So I encourage you all to take a look at that as well. Okay, so I know I zoomed through those last slides, but I think we have some time for like a question.
Yes, thank you, Dr. Tuna, for sharing this helpful information. The first question that's up is, I have a 21-year-old son that's away at college who reached out to me and said he's really sad. He's never had any mental health issues. He's always been academically strong. Do you have some suggestions for that individual that reached out?
Yeah, so first of all, I think it's wonderful that he reached out. I think that's amazing. And having that conversation as an ongoing thing of, tell me more about the sadness, or tell me more about what's going on, and continuing to go back to that conversation to see, would it be helpful to talk to somebody else about this too, of incorporating, we can go together and get some help if it is needed, but really praising him for coming to you and being so open. That just means that he felt safe coming to you. And I think that's great. Yeah.
Yeah, and I would take advantage of many of the resources that you've posted in your slide deck for folks who have more questions and want to reach out and talk to a professional about these issues.
Mm-hmm.
There was one other question that maybe we could squeeze in.
Okay.
With the ambiguity of prediction for suicidal behavior, should we assume that warning signs suggest suicide, i.e., should we assume the worst?
I think it means talk about it. So really making sure that you're having those open discussions and looking at all of the risk factors, all of the warning signs, but most importantly, what you know best about the person that you care about. But I really think we should be openly having these discussions more, destigmatizing, talking about suicide and talking about these things. And again, those risk factors and warning signs, they do exist. I mean, talking about untreated mental health difficulties is a big one. So when we see those things, making sure that you're connecting to care and that we have lots of interventions that will help.
Great. Well, we could talk about this topic for hours, right? There's just so much richness in it. I just want to thank you again for just doing a fabulous job of really giving us this information in really bites that we can digest, right? And so we're going to be posting the recording and related resources on the webinar series webpage. So please, 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 I encourage you all. I know I couldn't get to all the fabulous questions in the Q&A. Go on there, explore some of the resources, and be sure to note that the recording slides and resources from the first 4 webinars in the series are also available on that page. Again, I would like to thank you, Dr. Angela Tuno, for her time and expertise. And thank you to all of our attendees.
Thank you all.
We invite you to join us for our next webinar, which will be on Tuesday, April 27th at noon. And we'll focus on the mental health in children of color. Our speaker will be Dr. Erica DeRaza. Information about our upcoming webinars and recordings and resources from past webinars are available at the link in the chat that Susan is placing in there. And you can submit questions in advance of an upcoming webinar at this link. Remember, emotional support and well-being line at Duke, which Dr. Tuno shared, 919-681-1631. The support line is a free confidential service where you can have a supportive conversation, get connected with resources, and or schedule an appointment with a clinician. The line is staffed by a team of social workers, psychiatry and psychology trainees, and faculty from the Department of Psychiatry and Behavioral Sciences. This service is open to Duke faculty, staff, trainees, students, and their families, and is available Monday through Friday, 8 to 5, except for university holidays. I want to end by noting that if you're struggling, know that you're not alone. We encourage you and invite you to seek support. Resources, including our department's emotional support and well-being phone line, are listed at the bottom of the webinar series page. Take care, and we hope to see you in